Hey everyone, welcome to another episode of the Autonomous Health Podcast. I'm your host, Anmol Madan, and today we're going to talk to two really interesting entrepreneurs, so Mike Wang and John Gips, who are doing some really interesting work applying AI for inpatient healthcare at their company, Inspiren. Is that how we pronounce it, guys? Is that right, Inspiren?
That's right.
Yeah, so welcome, John, and welcome, Mike.
Thank you so much for having us. We really appreciate it and very much looking forward to the conversation.
So John and Mike, we usually start with people sharing their backgrounds, and both of you have such interesting stories. So I figured maybe just, take a tour of what brought you to the current company and the current problem you're solving. Maybe share some of your personal experiences along the way. That would be a great place to start.
Go ahead, Mike.
Okay, great. My name is Mike Wang. I am the founder and chief clinical officer here at Inspiren. Inspiren, the name, people ask this all the time. Ren, R-E-N, in Chinese means the purest form of altruism. And the name literally means to inspire that altruism. So Inspiren. So that's where that came from. My background, my first career was in the United States military. I spent 7 years in the United States Army. After the war, I came back and chose healthcare and patient care as my civilian path of service. Ended up specializing in cardiothoracic surgery at a major hospital in New York City. And it was at the bedside that I witnessed just an appalling number of preventable adverse events. And this was the best hospital with the most staffing and resources. And it came down to a very fundamental problem, which was we couldn't keep our patients safe when we're not physically with them. So idea came to me in terms of coming up with a sophisticated solution that can essentially allow us to drastically increase the safety of our patients and so on. So that was kind of the origin story, and then went on to start Inspiren and start building the technology with John. And ironically enough, when we first met, our visions were almost identical. John took out a PowerPoint, showed me what he was thinking about in healthcare, and it was exactly what was in my head. So we can go into that later, but founded Inspiren, and along with John built now what we have is called the AUGi platform, stands for Augmented Intelligence. We can tell you all about it later. But incredibly honored to be here, incredibly honored to have been able to share this crazy journey so far with John, who in my opinion is probably one of the smartest and most capable guys I've ever known. But along the way, we really just established this wonderful fellowship, as we call it, fellowship of this journey. So really awesome, and thank you for having me.
That's great, Mike.
Quite the tee up there, Mike.
John, that was high praise.
Man, every word.
I feel like everybody's...
Yeah, we got to bring it down a couple of notches. Maybe.
yeah. It's like the bar is high.
Maybe, Anmol, you can level set everyone back to the reality of how you know me.
I mean... I may or may not have stories about John from our classical days, but yes, that's.
Yeah, if I go up too many, if I too highfalutin about myself, you can always bring it down a peg or two. So, really happy to be here on Mall to reconnect in this context. So, John Gips, I'm the CTO of Inspiren. My background is, I started off my career, basically out of grad school, where I was with Anmol. We were at the media lab together at MIT under Sandy Penland, Human Dynamics group, which is great. Awesome days, some of the fondest memories of my life, working there in the Borg lab with the whole crew, doing wearable computing. It was awesome. It was kind of inventing the future. And really, Sandy was great and gave us a license to do so much. I mean, what an awesome time that was. Such fond memories. Yeah. A lot of friends out of there, and it's just great. Out of the media lab, I started a pet tracking company, and that was a memorable day when I told Sandy that.
And I just want to make sure everybody heard this. It's a pet tracking company, right? And so that was
Yep. Called Sniff Labs, and we had gone to Kai and presented a paper and gotten some national attention, and we wanted to go off and build things, and after the masters went and started Sniff Labs in a former methadone clinic down in the Leather District in Boston. That was awesome. A lot of great memories there too, and still some of those characters have featured in my story later. But anywho, we So we're tracking pets using kind of ad hoc wireless networking before Bluetooth Low Energy was a thing, and kind of early days pre-IoT, and created some pretty crazy products. And kind of where that pet tracking went, we didn't sell a ton of pet tags, but we got introduced to some folks in healthcare, and people started tracking doctors and nurses with our pet tags a little bit. It's sort of odd to think of it that way, but we're trying to got really hooked up with some cool people doing interesting research on complexity and error in critical care out of ASU. So Sniff Labs turned into general sensing. We took our core tech and worked on reducing preventable harm in healthcare, specifically reduction of hospital-acquired infections. And so I was off in Asia doing that for a while, and that was a really cool experience. And then, I kind of got beat up by the selling the hospital game for our hand hygiene appliance system, which was great, but it took me around the world. But I was sort of like, wasn't quite finding the demand there, I guess, or it was a hard sell. And I think someone had once, said it was a bazooka trying to shoot a fly, I think was the answer. And I remember Phil Liang, my partner, and I were like, that's crazy. Let's go do this anyway. So a few years later, we learned that lesson. And that was about when I met Mike. And I was like, hey, I'd kind of taken that tech into pivoted a bit into looking at the US market for patient flow and trying to help, staffing kind of keep eyes on patients more efficiently with technology. And when I sat down with Mike and we were talking this the other day, it was crazy, to see that Mike had kind of arrived at very similar things around rounding and, just seeing a need for technology to assist. And so basically I joined Inspiren as a technical lead, and I've been working with Mike since. So
yeah. And John, I know we joke about like sniff and pets and so on, but I think there is something fundamental here that I know both of you are passionate about, and I know others in the industry as well, which is about how do you bring data, machine learning, sensing inside the healthcare setting, right? And so when I look at the last like decade or so, and I think I have the same scars of selling into health systems, by the way, it's somewhere on my back. But, I think the last decade or so, we've seen like a massive revolution in what is not called, I said, digital health or hybrid health, right? So whether it's support for behavioral health needs or chronic conditions, telemedicine, primary care, it's essentially become like a new modality of care where a meaningful percentage of care, particularly during COVID, but I think even post-COVID, is now being delivered through those channels and supported through those channels, right? And so I think where you guys are coming on is perhaps a part that has been underappreciated or under-supported, which is what's actually happening inside the hospital, what's actually happening inside the doctor's office, inside the clinic, right? Where, again, like a meaningful part of our healthcare spend is in that setting, is in that context, right? And I think it may be worth actually talking about the current state of the world there, because I think one of the mistakes that AI practitioners like myself make is we kind of go straight to like, hey, LLMs and doctors and so on. But like I was just pulling up some of the data of what's happening inside hospitals, right, in the inpatient care. And Mike, you probably can even correct me and add more color here, but like the magnitude of the problem is massive, right? And so I'll use nursing as an example. There's a pretty big, pretty challenging environment in nursing that started during COVID and is continued post-COVID, right? So there's a McKinsey study from earlier this year, which says that 40% of nurses have an intent to leave the profession. And the actual turnover rate is about, between 23 and 27%, depending on, so like 1 out of 4 nurses is just leaving the profession, right? That's crazy to me. And maybe that there's good reason for that, or maybe there's something I'm missing. So I think that opens the door for like, what's the root cause here? And the other thing that's kind of interesting as we're recording this here in California, just I think 2 days ago, Kaiser Permanente is seeing one of the largest strikes in healthcare. So I believe there's 70,000 providers, professionals. And I think it'd be interesting to kind of talk about those root causes of some of what's happening here. Like when you think of wearing the hat of, seeing this from the front lines, before we jump into what AI can really solve for, I'm kind of curious, like, what is the underlying problem? Why is this so hard? Why is this so challenging? Like any insights there, Mike or John, you guys want to share from your experiences in the last decade?
Yeah. John, if you don't mind,
please, Mike. I mean, Mike, one of the reasons I'll say I was happy to join Inspiren is because of our nurse leadership.
Yeah.
I think that for me was the reason I wanted to do another go at healthcare, was meeting Mike, meeting the team, and actually being involved with practitioners and trusting that we would have practitioners like interested at heart. So I mean, I'm definitely an outsider to healthcare from that standpoint. So please, Mike.
So I just want to say it's funny that John's like, I've spent 10 years, but I'm still an outsider in healthcare. Yeah.
That's what
Yeah.
Totally.
Yeah.
I feel like that way,
Sorry, Mike, go ahead. Yeah.
It's such a good question because healthcare, and to me, healthcare has kind of these two big worlds, right? One is hospitals, right? It's all hospitals and doctors' offices and things like that, kind of group them in one. And another sector is senior living. And it's not a small sector, that it is a massive, massive, massive market, right? I think you are exactly right that those who want to jump directly into healthcare, especially hospitals, going from the test lab to the boardroom and jump straight into the patient's room. I'm here to tell you from my perspective, that is a disaster waiting to happen. That approach will not work, will not work. The word innovation in healthcare means very different things than other markets. In consumer market, innovation, oh, that's a new iPhone that just came out. Oh, that's just another really cool gadget that just came out and so on. Oh, okay. People like it, adopt it, boom, everywhere all at once. That's also why healthcare has stayed behind the consumer market always. Healthcare is always the last to adapt, most resistant to change, most resistant to innovation. And even if you are in innovation in hospitals, it's usually kind of a path to anywhere but commercialization. If you're in it for research, I think that's good. I think you're in it for other stuff. But hospitals is actually a terrible place to commercialize a product. Innovation is not a good word in that sector of healthcare. It's disruptive. Disruption is not a good word in healthcare, right?
But why is it not a good place to innovate? I guess can you give us the root cause of is it just the processes are too complicated? Is it like, it's like the emergency room is like things are running at 120 miles an hour and bringing new technology is a bad idea?
It's the nature of the beast, right? Healthcare works because of embedded protocols, embedded ways of doing things, and it's meant for the masses, right? It's meant for every healthcare provider inside a particular system to work a certain way and so on and so forth. By nature of it, it is resistant to innovation and to change, right? Every hospital system, of course, focuses on innovation, and innovation is one of the pillars of every single ethos, right? However, as a startup or as an outside company creating a brand new product, it is very, very difficult to, one, break through the bureaucracy and the nature and the hierarchy of a hospital system. Imagine just from this perspective, in order to go live at a hospital or to test or pilot your product, do you know how many decision makers have to give the go-ahead in order for this to even remotely happen, right? And we got very, very lucky, and we're very thankful for our early partners for giving us the chance and for actually pushing through. But it was a Herculean effort to push through and to actually make it happen, right? Without them, we wouldn't be here. However, most other cases, it would be very, very difficult to come from as an outsider. And the only reason we made it happen was because we were insiders.
Right. And so, Mike, but just to kind of fast forward, right? So I understand the challenges, but if you could imagine if we lived in a parallel universe and you could have anything.
Yeah.
Right.
Yeah.
Like, what problems do people need to be solved? Is it a automation problem? Is it a workplace culture problem? Is it like really a data and sensors and signals problem, like the one perhaps you guys are in the trenches of right now? Like, what are the ones that are holding the whole system back? And you may not have a clear thesis. I'm just kind of curious if you do, and if you do, I think the audience would love to hear it.
I think it's a labor problem, as we all know, right? The sheer number of those who require care and those who are capable of providing that care, that ratio is completely off, right? And
but is it a labor problem because of workplace conditions and no one wants to work the way that people are expected to work?
Part of it, and also another part is it's an augmentation problem too, and that's why we're in the market, right? Pure human reliance on human labor and human manual processes and so on, by nature of it, it can no longer work because it's a numbers problem, right? There's only so much you can squeeze out of a human, and there's only so many humans that you can train and so on, right? So without automation and augmentation, it is impossible to keep up with the demand. It's impossible. Right.
And so then that takes me to kind of part two of that conversation, right? Which is clearly there's a workforce shortage. Clearly there's something about the work experience that's making people want to leave, maybe the complexity of it, maybe the challenges of it, right?
Yeah.
And I think it's pretty powerful to kind of hear from you all, but also from the broader nursing community, right? And understand that. And then part two is in every other industry, we throw machines at the problem in a scalable way, right? I mean, people worked in factories and now like machines, build cars, right? And so that's happened in every other industry. So let's apply that to this particular example. And specifically, I think there's a couple of parts here when I think of like the role that machine learning or AI or automation can play, right? So there's the machine vision side of it or the sensing side of it, which I think you guys are thinking hard about, right? And you're like, okay, it's funny, we've been talking a lot about co-pilots for healthcare. We've had 2 or 3 episodes in just the last, I'd say 8 or so that have spoken about LLMs and kind of co-pilots for doctors and things, right? But where is that, why isn't anybody talking about those technologies or those enabling technologies for nursing or for inpatient settings or for other providers who are not doctors, right? So I think that's one theme to uncover. And that's sort of maybe a more today conversation or next couple of years conversation. And then part two of this is like, this may be crazy talk, but just to kind of ask the question, what is the future of robotics in nursing? Right? Like, and should they be like, turning, patients on beds to avoid risk of bed sores? Like, should machines be helping with that? Right? And like, are those kinds of use cases that we expect? And so if you think of like, what's the task that a person's performing in an inpatient setting, I want to hear kind of like a deep on the sensing part. We'll go there, but also like, if I think those are the 2 areas where imagine like the inpatient experience like 50 years from now, those 2 things are probably fundamentally different, right? Or even 25 years from now. Is that right? Am I thinking about this right? Or is this completely wrong?
You are. And I would even take a step back from that, right? Right now, even the very fundamental of patient care, for example, how do you know your patient is okay if you have no vitals hooked up to them, right? How do you know they're safe? How do they know that they're okay? Right now, the only answer is you physically have to walk into that room and check on that patient, right? That is a manual task. That might not be clinically focused, but that's a manual task you must do, right? How many times must you do that? Well, hospitals require you to do that once every hour, right? And if you have 6 patients, 7 patients, you can do the math on how much time that requires, right? So if machine can do a more consistent, higher quality job at that very simple thing, such as checking on patients. You're not even doing sophisticated procedures or anything. It's just checking on patients, something so fundamental, right? That time given back to the health provider now becomes very, very valuable, right? So that's kind of where we started. When talking about robotics, automation, other things, we're not even talking about, there are some very smart beds that folks are building that can turn the patient, that can, alleviate their pressure injuries and so on. So, and that is a great part of it, right? Robots actually giving AM care to a patient or getting them out of bed and things like that. Eventually, sure. But I think there are a lot of obstacles. And there's even a company, it's called Diligent Robotics. We were in an accelerator together. They literally build robots for hospitals. And these robots go around, deliver medication and stuff like that.
Right.
How far are we to see like robotic nurses completely void of human interaction and then coming to help patients and so on? Maybe Boston Dynamics can get there, but we're very far from it, I think.
Can I share what my perspective? I think I may agree with. I think like eventually robotics may make sense, right? If we can get to, an Android, right? Sure, why not? Of course, something that offers that bedside manner and, it could be humanized still. I mean, I think the human touch is still probably pretty powerful, right? And maybe there's a nice Android that can pull that off too.
Yeah.
I think my takeaway from hand hygiene compliance was that nurses are so busy, like the frontline staff, there's so much going on, and it's always a perspective of, oh, you just need to do this sort of one thing and then you can unlock some benefit, but they get overlaid. I mean, like how many, different technologies, and we talk about kind of trying to unify that. There's just so many different things that we try to layer on top of an already busy person who's multitasking and doing all these things. So I think for me, like the technology can come in as a way to be assist, like pure kind of like always question any ask of the nurse and just, but really try to be there to kind of add capacity. And I think as Mike was saying, it's like that's our perspective, and like that was my takeaway. That like as a guiding principle is like really try to add way more without any ask. These people already asked to do so much. It's like what can we just pure add without trying to kind of have an ask to enable it first.
Like how do you simplify their day, simplify each step of what they're working on? And I mean that's the tricky part in the space you're in, which is how do you insert yourself in the workflow of someone who's like super busy, running through a lot of tasks, and do it without becoming like a pain point, but actually be an asset, right? And without making it like more frustrating. It's like, here's one more thing I've got to like check the box on, right?
Yeah.
Is that the guiding principle? Did I capture that accurately?
To me, I think that's right. I mean, like when I think of the technologies we're evaluating to bring in, I ask myself, what is the ask we would need to make this work? And it has to be weighted, like it has to be a huge return in order, to ask the frontline staff to do something different or whatever. That's, I'd say, like, a critical element of how we approach things is like trying to be just to add and not try to, have some trade-off that you have to make. Or I feel like, Mike, you've been there at the front lines of it. It's just, as an observer, I've been in plenty of hospitals and seeing these people. It's like, I remember with hand hygiene compliance list, just wash your hands more. It's like,
Right.
well, they're doing so much. You see someone actually trying to be compliant with like Joint Commission or, it's like an act of, it's like a stage act, it's like, boom, wash your hands, go in this. So it's like these people are already tasked so much that it like to add another thing to their workflow, another technology, it's like, it's a high bar, I feel like. And so it's got to have a lot of payoff.
And so you think like product design, thinking through the experience is as important as just like better sensing and more automation?
Oh, 100%. I think it's like if it works in the lab, it doesn't really tell you that much. Like it only works if like, people accept it, embrace it, and the change management works. And like, it's just, it's rewarding. And I think it's a whole gauntlet to run after it makes it out of the lab into people's hands, which is an interesting challenge, right?
Yeah.
So I think that's
Very cool.
kind of been a focus for us.
So that's kind of the framing of like the pain point, you kind of help us understand, what's hard about it. And so then talk to us about your approach, Mike and John, and, what parts are you tackling at Inspiren? And then what do you think is, the state of the world today with the technologies, and like what would be, the future state? How far do you think this sensing and this capability can go? So that'd be a great segue. We'd love to hear more about that.
One really unique thing about us is every functionality, every capability is thought out from the caregiver's perspective. From the lab to the design to the UX, every single part of it comes from a place that's realistic. And I think that's so incredibly important. Like John said, like that's what drew him to Inspiren, is because we do everything from that perspective. Why? Because if there's no adoption, you can have the best thing in the world and it wouldn't matter, right? So every side of it has to really serve the need of the caregiver. That means not requiring them to do anything extra on top of what they already do so much.
And sorry, Mike, could you just want to give some context on what AUGi does today?
Sure.
That'd be just that context would be helpful, I think, for people listening.
Sure. So AUGi is a hybrid sensing platform that clicks right on the wall. It's one singular device that clicks right on the wall. I don't know if you have video, but this is actually what AUGi looks like. Right? This is the actual real AUGi.
Yeah.
And it's a hybrid sensing platform because it fuses the data from multiple technologies that we put in. It's an edge computing device, so it actually does the computation on the edge. And once you put it up, you never have to touch it again. It basically digitizes the entire environment, knowing what is in the room, who is in the room, and what are people doing in the room. So it extracts clinically significant data, and it prevents harm in two different ways. And it's a combined holistic effort. One is what we call in-the-moment prevention. So, hey, this person is walking in a really dangerous way and looks like they're imbalanced. Let's get someone there to intervene to make sure they're okay. Preventing that incident from happening in the moment. But another layer of prevention that makes us extremely effective is AUGi also learns over time this person's behavior, right? How do they get out of bed? How long does it take for them to go from A to B? How often do they go to the bathroom? And so on. We collect this data, we see an overall trend, and we can put that into a prediction of what is the likelihood of this person ending up falling or getting hurt and so on. So AUGi collects the data from the physical environment, turns it into actionable data for not only the clinical teams, but also for the operational team. So AUGi also measures what we call care intensity. He actually knows how much physical care are you actually receiving on a daily basis. That impacts two things. One, it allows us to be able to give guidance and recommendations on staffing. So staffing, then we're talking about labor, right? If you don't know where your labor is actually being expensed, if you don't know how it's distributed and where the focus is, then it's very difficult to optimize it, right? Because you're basically trying the carpet bombing approach, trying to cover everything. And that's when labor shoots up drastically. But if you know where you need to expense the most labor, why, and you can actually distribute your labor more evenly, optimized, then obviously that has huge economic implications. So this care intensity impacts that. And also in senior living, it identifies folks who are needing an increased amount of care over time, right? That means they start to deteriorate. They're becoming less independent, therefore allowing us to be proactive about the care and services that we provide to these folks. And on average, we're looking at anywhere between 8 to 14 months additional time of independence and quality of life, right? So AUGi, a singular hybrid sensing platform, digitizing the physical environment into clinically significant data that allow us to prevent harm, as well as using it as an operational intelligence tool for senior living as well as hospitals.
Very cool. John, you want to talk about like what are the kind of sensing or perhaps even machine vision, interesting pieces of the puzzle here that
Sure.
differentiate or make AUGi stand out?
Yeah, sure. I mean, we have a number of different technologies in AUGi, and I think back on multi-wearable days, it's sort of like, where we had the facilitator room, which was sort of like the opposite of the wearable approach, right? And so I've sort of been working more in the facilitator room mindset. Past with hand hygiene compliance was we had a wearable for staff, but we actually do have an ID as well, which is one of the asks we make of staff to have like for beacon identification. But so it's basically our thought is, we have this little piece of real estate that go on the wall, the AUGi goes onto, and we've got computer vision platform and an NVIDIA platform. As Mike said, it's all edge-based, a few different models running there in real time. And we've got a millimeter wave radar in there to help with some complementary data with the CV side of things. And then we've got an angle variable Bluetooth system in our latest generation to do identification. So,
and then what's unique or hard about applying some of those computer vision and sensing approaches in like an inpatient setting? Like anything that's kind of particularly, like, I'm assuming privacy is a big discussion.
Privacy is huge. Yeah, privacy is a big one, and that's part of the reason we chose to be at the edge, so we could sort of be able to get all the critical bits out right, and then kind of drop the stuff we don't need. Thinking back to another MIT learning, I'd say. You're familiar with that? Yeah. So I think that's privacy is huge. I mean, to have a computer vision platform in an intimate setting like a residence or a patient care room is, you have to kind of treat the data with a lot of respect, and you have to, really kind of shouldn't just be a kind of grab for all data. We want to be really good stewards of that sensitive data. So we sort of have taken the approach of doing extraction of the data at the edge, get the parts that are important for our use cases, and then be good citizens of that, and then kind of drop what we don't need is sort of our approach. Of course, there's always like learning and training and things like that, and that's required to drive models.
Yeah.
But it's nice to be able to give assurances that we collect what we need, and the data is anonymized when it leaves. So when we have it's sort of like a webcam too, right? Which is useful. It turns out, I've got a little kid. Nanny cam's kind of a nice thing sometimes, right?
Yeah.
So we do have that. We do it anonymized though too. So our approach is to blur the image data. So if someone who is not the caregiver happens to see it, at the nurse's station or a nurse's phone, they're not going to be freaked out. Like that data is de-identified, and we overlay some of the CV stuff on it to kind of call out the subjects. But very much privacy is a
Yeah.
big part of it.
And so so that's where AUGi does. That's kind of the vision of the product you all have been building. And then tie that back, Mike and John, to like the impact that it's having for healthcare workers or healthcare organizations, right? Which is going back to the complexity of managing large, inpatient or at home kind of populations, sort of saving time, saving effectiveness, allowing ideally, I'm hoping this also translates into kind of better quality of life, right, for the nursing staff, for people doing inpatient support or support at home kind of places. So walk us through like how does this translate into like impacting the bigger problems you just laid out a few minutes ago?
Well, from a safety perspective, we're seeing very impactful results for safety, looking at approximately 70% reduction in injuries, in harmful events, and drastic decrease in hospitalization. So from that level, our goal obviously is to prolong the quality of life of a very vulnerable population. So from that perspective, we're seeing really very promising results. Even in the hospitals, we just recently published a study with New Valley Hospital where AUGi is in every single room. Even with hospitals, they're seeing drastic decreases in harm, in preventable harm specifically. And also overall increasing the number of touch points between caregivers and those who they care for. Increases in touch points is always a good thing, whether you're digitally checking on them or physically checking on them. And in some scenarios, digitally checking on them with certain kind of frequency allows you to be able to see them in person with higher quality interactions. So from all of those levels, we're seeing the impact as a decrease in harm and decrease in injuries and prolonging the quality of life. From the staffing end, the labor end, we're augmenting the existing labor. The goal here, making it very clear, is not to reduce staffing, say, hey, we're going to take over and you can let go 25% of your staff. That's not the point here. The point here is to augment the staff everyday activities so they can do more of what they signed up to do in the first place, which is not charting, which is not sitting in front of a computer, but is that compassionate and capable care that it deliver at the bedside. So if anything, we allowed them to do that more than the really repetitive and non-clinical and non-human side of things. And last part of that is we recognize staff. We actually recognize them for their hard work. We award them for their hard work. We have something called the AUGi Award that we give out to staff on a weekly basis. We see that as a necessary part to give back to a workforce that mostly is known as a thankless job. Oh, you care for people because you're supposed to. Well, that's not necessarily true, nor is that the best culture to have. We recognize our nurses, we stand behind our nurses, and we also make sure that our entire goal and job is to make their lives easier and make them better, right? When we engage customers, I have what we call the nurse-to-nurse talk. So I pull up a chair next to them and ask them a very frank question. Hey, pretend I'm just one of your fellow nurses, fellow caregivers. What do you really think about this technology? Is it helping you? Is it providing value?
Yeah.
So on all of those fronts, we're checking the boxes and we're measuring our impact in that kind of manner.
Yeah. John, anything you want to add to that? Anything on the impact it's having that's been sort of personally exciting for you or noteworthy for you?
Much just to see just have a tool that lets them give them more bandwidth to kind of care for patients has been exciting, and as a force multiplier for staff. I think organizationally we've been making good strides to help give visibility into the whole balance of kind of the labor demand and like making sure they're the right staffing levels and stuff. That's very exciting. For me, it's like seeing someone who can be efficient and have more impact that they want to have has been really satisfying through the tool.
Yeah, and I think this for me, it sort of resonates in a personal level because I've seen this in behavioral health. I've seen this in chronic conditions after that, where when used effectively, machine learning, AI, sensing, and then eventually automation. I think maybe we're 5 years away from sort of automation or 10 years or 15 years. But at some point, I think all of these need to come together and really make the inpatient experience or in-setting experience dramatically different than what it is today, right? And so we want, humans doing the highest caliber work, kind of having great quality of life. And just as, like you shouldn't have to hold the rudder for like a 24-hour flight on transcontinental airlines, like, co-pilots can do that pretty well. And you should maybe be involved when there's actually real human need. And I think that is truly, in some ways, I think like the inpatient elements and nursing community is almost like underappreciated or underserved in that regard. And I think this technology and others like it have a chance to kind of truly elevate and give them the same level of augmentation, if I may use that word, and can't replace, as Mike, you mentioned, the human experience, but really kind of strengthen their ability, strengthen their impact. And so I think I'm really excited to see where these technologies go. So with that, I wanted to thank both of you, Mike and John from Inspiren. Thanks for coming in and spending some time with us and telling us about your journey and sharing your insights on what's happening in the industry right now.
Thank you so much.
Thanks, Anmol. Good fun.
Really appreciate it.
Thanks again for listening. Once again, this is your host, Anmol Madan with the Autonomous Health Podcast. Thanks again.
Thank you.